Hi, and welcome to the Rotator Cuff Expert YouTube channel. My name is Dr. Dr Orcutt. In this channel, we talk about all things rotator cuff. The point of my creating this channel is to give education and knowledge and understanding about what it means to have a rotator cuff injury. There's lots and lots of questions from the very beginning to the very end. There's lots of unknowns, and so my job here is to try to educate you, to protect you, and to enable you to get through this surgery and this time of life as easy as possible. We know that rotator cuff surgery and surgeries on the shoulder are not easy, but my job is to try to make it as easy as possible for you. So if you have any questions, any thoughts, please leave them down below. Please subscribe to the channel, YouTube Rotator Cuff Expert. Also, we have another website that we talk about so a little bit of different things, as well as there's some products and things that you can help you get through your recovery, and that's at the website is myprotector.com. Anyway, thank you so much, and hope you enjoy the next video, and we will talk to you in just a minute. Hi family, welcome again to the Rotator Cuff Expert. So today we're going to talk about injections in the shoulder. Now there's several places where you can get injections in the shoulder, and we'll talk about why you might get an injection, what the injection would be, and what we would expect, and where in the shoulder can you get an injection. So the first step is, what would we inject, right? Because there are different things you can inject in different parts of the body, but technically in the US anyway, the only thing that you can inject that is on label, that is approved, is a steroid injection. So there's a bunch of different kind of steroids we inject. The key thing is that it is a steroidal injection, which means we talk about non-steroidals and steroidals. And in this compartment, in this manner, they are both anti-inflammatories. So that's the idea. The idea is to inject somewhere in the shoulder to decrease the inflammation, to improve your symptoms, right? So we can do non-steroidals, which would be orally, Aleve, Advil, ibuprofen, all those kind of things. So those medicines we'll do orally, and they're a non-steroidal, which means they're not a steroid, they're something else. Their chemical composition is different than a steroid, and so, but is an anti-inflammatory. And so depending on your health history and your issues with other things, a non-steroidal anti-inflammatory may be the right starting point for anti-inflammatory. And oftentimes when people come to see me, they've already tried a non-steroidal anti-inflammatory. It has not worked, okay? So the next step would be a steroidal anti-inflammatory. Steroid just means a specific chemical compound picture or anatomy of the compound. So when we talk about steroids for injections in the shoulder, we're talking about the steroidal anti-inflammatories. We're not talking about anabolic steroids, right? The bodybuilders take that get them big. We're not talking about that kind of steroid, because that's a completely different steroid. It is still a steroid, which means the chemical composition is of a steroid, and we could go into that, but that's really boring and we won't. But it's a steroid, and so we inject a steroid anti-inflammatory. Again, the idea, inject the joint, inject a spot with a steroid, decrease the inflammation, and hopefully ultimately get you through the event, okay? So there are many different places that you can inject a steroid. One of the places would be, and most common, is this right here, the subacromial space, okay? So if we look at the acromion, which is this bone here, below the acromion or underneath the acromion, sub the acromial, is a subacromial space. Well, guess what's there? What's there is the rotator cuff. So if we have rotator cuff irritation, inflammation, we may inject right above the rotator cuff, right below the acromion, in the subacromial space. The idea is that's an anti-inflammatory. Decrease the inflammation around the shoulder, around the rotator cuff. Hopefully we decrease the inflammation, and if it's a traumatic event, that's all we need to do. We take the anti-inflammatory, inject the anti-inflammatory, calms things down, everything's great. Now, if it's more of a long-term problem, then we hope the steroid will decrease the inflammation. While the inflammation is down, we do exercises, rotator cuff exercises, to strengthen that rotator cuff, so that when the steroid ultimately stops working, which is debatable when that might be, it might be 6 weeks, 8 weeks, 3 months, I don't know. It's really not clear. It actually depends on what kind of steroid you inject. But either way, we're decreasing the inflammation. So when the inflammation is decreased, we strengthen back up. And when it's strengthened, and the rotator and the steroids wears off, we're in a better place than we were before. So that's the first and most common place, subacromial space. So second, we could do an AC joint injection. So the joint on top of the shoulder, so this is the clavicle or the collarbone, this is the acromion, this joint, the AC joint, which is the joint actually also when people talk about having a separated shoulder, that's the joint that gets separated. We also can have arthritis here and we can have some irritation of the joint. So we may inject the AC joint with steroid as well. And so if we inject the AC joint with steroid, again, the idea is to decrease or calm down the inflammation and get you through that traumatic event. And the next one we could do a glenohumeral joint injection. So the glenohumeral joint could be arthritic or irritated. Or we might decide to inject steroid into the glenohumeral joint. So again, the idea is to decrease the inflammation. So depending what your problem is would determine where we're going to inject the shoulder. Another point is the bicipital groove. So sometimes people have biceps pain, right? So the biceps muscles here, the biceps becomes a tendon, it goes into the shoulder joint and actually attaches on the top of the glenoid or the top of the socket. So sometimes the biceps can be irritated. What we might do is inject the bicipital groove. If we inject the bicipital groove, it decreases the inflammation around the biceps. And again, the idea is to decrease the inflammation, make you feel better. And the last one, which is not truly technically in the shoulder, but we'll include it anyway, is a trigger point. So when you have an irritated shoulder, there's many places you can have spasms around what we call the periscapular muscles or the shoulder blade muscles or the traps and muscles up here. If you have an inflammation and you have a trigger point, which means a spasm, a specific pinpoint spasm within that muscle, we may do a trigger point injection. And so those are the general ideas: AC joint, subacromial space, bicipital groove, glenohumeral joint, and trigger point. Those are the general spots that we may inject in the shoulder. And again, depending on what your problem is would determine what we would inject. Where we would inject. Almost always what we inject is steroids. There may be some strange situation that might inject something differently, but as far as I can think off the top of my head, that's not the case. The case is actually steroid is just about where you inject. And one last thing, people talk about ultrasound guided injections. And so this is a little bit overused in orthopedics. The ultrasound helps us get the shot where it's supposed to be. And depending on your expertise would determine whether or not you really need to use ultrasound. Where you're injecting also depends on if you really need ultrasound. So I would tell you that if you are an experienced orthopedic surgeon or an experienced provider that does a lot of injections, the subacromial space, occasionally you might need to inject under ultrasound, but typically not. The landmarks of the shoulder are relatively easy to find, relatively easy to put that injection. Again, there's exceptions obviously, but that's a general trend here. The AC joint, now that's a little bit different because the AC joint can have a bump before or after. And so sometimes the AC joint it can be difficult to tell whether the AC joint is here or here or here. So more likely than not, if you're not sure, it would be much more common to do an AC joint injection under ultrasound. Same with the biceps. It's a little bit hard to find the bicipital groove. So oftentimes, not always, but oftentimes we may use ultrasound to find that groove, and you can actually see it really nicely on the ultrasound. Find that groove and inject it there. The glenohumeral joint, plus minus, depending on the person. Trigger point, very, very rarely. The trigger point is actually palpable. You can feel that trigger point. So you wouldn't need ultrasound typically to inject the trigger point. So we would inject multiple places depending on where your pain is, depending on where your problem is. We typically would inject a steroid in that spot. Rare to think that there's something else that we would inject there. And lastly, we would use ultrasound sometimes. Again, it depends on the expertise of the physician, but in general, some places we ultrasound, some places we don't use ultrasound. So I hope this helps. Again, we've been doing a bunch of these videos and I hope that I'm getting to all the questions people have. But if you have other questions, other things you want to know about the shoulder recovery after surgery, shoulder recovery without surgery, shoulder recovery, or any shoulder issues, any questions, and even maybe a global question about orthopedics. But in general, if any questions, please leave below. I read the comments. I will respond to the comments. I will do as many videos as we can to make sure that when you're having difficulties in the shoulder, that we are a place to come to understand what's going on and hopefully to guide you through the recovery. So anyway, that's it for today. Hope you have a great day and we'll see you next time.